assuming that many of you won't have come across us before. So we are 15 organisations who operate nationally as a single network. We are funded via NHS England and the Office for Life Sciences. And our funding is essentially to support innovation and innovation products into and out of the NHS and social care. So you might be that person who is working in a GP practice, has an idea for a widget that's going to help save the NHS, but you've probably got no idea how you would get that widget built, what regulations you need to think about, how you would get it in front of an audience. So we will work with you as an innovator from the NHS to help get a prototype built, to help get rules and regulations done, to help get those kinds of things done so we can get your product out there and getting it used. Similarly, you might be an SME on the banks of the Tyne down in Team Valley or somewhere like that, and you've got the same idea for the same widget that's going to save the NHS, but you've probably got no idea how to get it in front of a bunch of nurses or a bunch of doctors to get it tested, how you would get it in front of patients to get their feedback. So we again work in that middle ground between innovation and the NHS. We use this pathway. I'm not going to go through it. It's quite complicated, but just to give you an idea that you can come to us with anything from a really, really early idea, and we'll help review the market and see if that idea is already out there. We might help you to think about intellectual property. And then we go all the way through clinical trials and evidence, all the way through to actually hopefully getting that innovation adopted and used widely. And I think the good way to think about this is a bit like a funnel. So we might get 200 or 300 ideas coming in at the beginning, and we might only get 1 or 2 of those ideas actually pop out at the end after it's been through all the market review and testing, clinical trials, and all those kinds of things. So that's broadly what we do. For this program here, our integrated care board is one of 3 integrated care boards that have been commissioned to look at how we can support or improve economic inactivity for health-related reasons. And our particular integrated care board got nearly £20 million to look at that. And of that £20 million, around £1.5 million was specifically to look at digital interventions and digital platforms that could support that process. So this is where Health Innovation, my organisation, stepped in, because we're used to working with innovators, we're used to working with digital products, we're used to working with industry in the market. They asked us to come in and support the system to do that specific wedge of the pie, which is around digital intervention. So we've done that. We're supporting 4 digital interventions. You've been invited to a number of those. We did that because we did a very, very broad call to industry at the beginning of this calendar year. It was around about January, February time. We got something like 130 applications of people who were interested, said, yes, our innovation can help you. And then through a very drawn out, complicated process, we narrowed that down to where we had a Dragon's Den. I think that was around July time. And then out of that, we're going to support 4 interventions and 2 local projects going forward over the next 9 to 12 months. And the particular one that you're going to hear about today is Dr. Julian. I'm not going to go through this at all because that's just getting into territory that is clearly down to the Dr. Julian team. So just to repeat, if you've got any questions, please pop them in the chat, and the team will monitor that chat, and we will look at answering as many as we can as we go through. If there's anything that we do miss, we will follow it up after today's session. So I'm going to stop talking now. I'm going to hand you over to the Dr. Julian team, and thanks very much for attending.
Thanks, Dave. So hi everyone, lovely to be on the call and to be supporting your region. So I thought what I would do is just give a bit of background about what we do, and then and how it sort of came to be, and then I can give you a bit of a demonstration of the platform itself. So I'm Julian, the embarrassingly named Dr. Julian. It wasn't my idea for the original name, so sorry for that, but it's kind of stuck. Doctor by background, I still work a week as a GP, and I founded the company, it was 9 years ago now, because I wanted to try and improve access to mental health services. And I thought that the technology that we're using in the NHS isn't up to scratch. It's very outdated, and the waiting lists were just crazy. And I thought there has to try and be a better way of getting people access to mental health support faster. So I thought, why don't we build a platform out that crucially includes the patient-facing side? Because I never understood why the electronic record systems that we all use, why don't they have a patient side to them? So I thought, okay, let's try and build a much more modern, user-friendly, modular platform that includes that patient-facing side. And we started out as a therapy service provider, essentially, and that's sort of our core business. And we've kind of built the technology over the past 9 years whilst providing therapy services. We're sort of nationwide now as a therapy service provider. We do some of the national contracts like the Veterans Ops Courage contracts, and we support local talking therapy services where we can take extra capacity from our I think 350 or 400 or so clinicians. We pretty much cover the whole spectrum of mental health. And we've started to do ADHD pre-screening services as well as full ADHD services as well. So we pretty much cover that whole pathway. And I think the platform itself was around giving patients more empowerment, so enabling them to book their own appointments, have a much wider network of clinicians. And by having that much wider network, you can actually find the right therapist for that individual, or that, even if that's like cultural preferences, language preferences. So in a way, not operating any waiting list, because you're getting the person the right help quite quickly because you've got that much wider network in which to get that support from. And the platform itself then grew, doing lots and lots of different things. This sort of full electronic record system, case management system that's much more modern in the back end, alongside that sort of patient side. Having done the therapy services side of things, people started coming to us to say, can we use your platform to operate our services on? So then we started a licensing model where organizations, if you heard of NHS Practitioner Health, Vita Health Group and others, use our technology to operate their services on. But because it's modular, you can use bits of the platform that you want. So it could be that one service actually just wants to use the patient side or the front end of it. Another service wants to use the whole thing. So the video conferencing, the booking system, the ability to undertake electronic assessments, and the full electronic record system in the back end. So it was sort of very modular and flexible in that approach. And we built out this feature called the resource library, which is a simple thing to think about, giving someone access to self-help tools and resources because we have that patient-facing side. But crucially, with our platform, we can set up lots of different services in the back end, and actually you can use our resource library builder to build out a resource library for that individual region. And then we thought, actually, this could be really helpful for things like social prescribing and getting people back to work, because you can use it as a population level tool to provide self-help tools and resources in a localized way, so each service, but also crucially, because of our patient side, every patient gets their own unique personalized dashboard, and therefore patients themselves can have individualized resources that suit them. So they're able to sort of access personalized resources for them. And then we can actually monitor the outcomes of that. Because patients are on their own dashboard, we can get them to undertake various assessments, whichever. We have a form builder, so you can build out assessments, but we have all the electronic questionnaires in mental health and in getting people back to work, etc., that people can take, so that we can actually go, right, well, this person's used this resource and actually has it worked or not? So let's measure the outcomes of that, and then we can report on that. So that's the kind of difference between the static tools that I guess are out there now and this sort of much more localized and personalized way that measures outcomes. So this is a use case that we're now deploying with yourselves, which we're really excited about, is to use this resource library function bit of the platform to provide people self-help tools, resources for mental health and for getting people back to work. Now we're deploying this with our library to start with. So we've got a whole range of, sort of self-help tools and outlinks for the validated mental health resources that we have. They can include things like guides, worksheets, videos, audio files. We've got meditations, etc. But I think as we go along here as well, you guys might have your own leaflets, handouts, or localized services that you guys offer that we can build into it using the resource library builder. So we can create this sort of localized resource libraries that are specific for that population. And then the patient gets access to that dashboard for life. So enough of me whittering on. I'm going to show you it so that it sort of makes a bit more sense. Can you see my screen? And sorry, we had to bodge a logo off the internet, I think. So this is why this is coming up like this. But essentially, once we get your proper logo, we can have nice graphics here for your logo. This shows the patient-facing side of things. So the patient will have access to their own personalized dashboard, as I was saying, and they can access this from a web app here via a link, but also from iPhone, Android apps as well. When the patient goes in, I think we're starting out at the moment where they can self-register themselves. So you can share the link with them and then they can go in and log in. So when they click the register now button on here, they will then just have to enter their NHS number and they will be able to register with their email address. And then they will get a link of how to log in and set a password for the platform. Once they then log in to the platform, we've built this to not include all of our other features, as you know, where we provide therapy services with the booking systems, etc. So this is purely for the resource library function for sort of social prescribing and getting people back to work. So as part of this, we've got the questionnaire here, the Wellbeing at Work questionnaire that patients can undertake through their dashboard. We also have all the other validated mental health questionnaires like PHQ-9, GAD-7, etc. But those can either be put out so that they're always there, or they have to be assigned by someone for which the person to undertake it. So if they click to do this Wellbeing at Work questionnaire, they would just go through and select the relevant answers, and they will type them in, etc. So you get the idea of that. So they'll go through and do that questionnaire. Now, if it's a scoring questionnaire like a PHQ-9 or a GAD, it will come up and they will be able to see their score, and they can go back and look at the history of their assessments and see how they're improving on that. So that's how we can sort of collect the outcomes data from the questionnaires. And then from the resource library perspective, when a patient logs in, they can select the certain issues that they're having a problem with. So it might be, okay, I need help with depression or whatever. And then it will be able to give patients the right resources for their problem. When it's, let's say they want some CBT resources, or let's say they've got low self-esteem resources, it can bring up those types of resources for them. So we've got a whole range of resources that, again, freely can share with you all of them, so you can have a look at them. But we'd love to include some of your resources that you might have as well, that you can actually build into the resource library builder. So you've got a whole range of resources. Those can be favorited, and the whole point being is that this patient has their personalized dashboard so that they've got the right resources and tools for them, essentially. And as I said, this could be worksheets, guides, audios, meditations, etc. So we've got a whole range of different resources that we've built out from a mental health standpoint, and that's sort of to try and help people get back to work from that perspective. The profile itself, I mean, we also collect the demographic details as well. And again, because of the usefulness of this, is if we're deploying this across a population, we can then actually look and see, right, well, this person from this demographic has used this resource and it's worked in this way because of the outcomes. And actually, we can then report on this in a much sort of wider way, which I think will be quite interesting. But it's quite easy to use. The patient can go in and they can log out, they can change their password, etc. Through this backend. But very simple. This use case of the platform is to provide the self-help tools, the personalized resources. Obviously, not all of our other features as well. So I'm just going to move on to the backend now. So all of you who are assigned admin access can log into the backend of the platform, the sort of case management system. And again, for this use case, there's a few features taken off, but essentially we can assign admins with different levels of permission for different roles. So we call the different services that we operate tenancies. So for instance, we can set up a number of these to provide different localized services that we can attach a resource library to. But I think we're starting out, I think, with just one, which is your sort of health innovation Cumbria. But again, if we want to build more, we can. And then you will have access as an admin. You just log in via the staging server, and then you can go into that. And you'll be able to view, again, if you've got the permissions for this, obviously, you'll be able to view all the patients that have registered themselves, or you can add patients into that tenancy by clicking the Add Patient button, and then you just fill in the details here, and then that patient can then be added. And then what will happen is that patient will get an email link of which they click to then go and set their password up. When you look at the patients in the back end, so you can actually go into that patient, and this is a sort of semi-electronic record system, so you can use it for that purpose. But you've got the ability to view the demographics and the information of that individual. Again, appointments, we've turned off on this bit, so they're not doing appointments, but you've then got the ability to view any notes. So if you wanted to write any notes or any contact that you might have had, obviously you'd be using your own system as well for records, but it might be that in here you also want to add a note. So you can add a clinical note here, or you can upload documents, and you can do lots of different things on that to sort of keep a record if you wanted to in here. In the questionnaires section, you'll then be able to see the questionnaires that patient has filled in, and you can do the drop down and look at that, and you can do downloads as well. And also, if you want to fill a questionnaire in on behalf of the patient, you can click Fill a Questionnaire button, select the questionnaire that you want to fill in, and then you can fill that in yourself, and it will so that, again, that's like when we do it for therapy. If a patient hasn't done the questionnaire, but we keep reminding them, and we have an email system that reminds them, a text messaging system, and an in-platform notification system through our messaging center here. But again, sometimes if a patient hasn't done a questionnaire and you want them to, you can fill that in on their behalf. You can also assign questionnaires to individuals. So you click Assign Questionnaire, and then you can use the questionnaire that you want to assign, and then that will show up on the patient-facing side for that patient to fill in that questionnaire from that perspective. And then on the resource library function, again, depending on the resource library that's there, you can assign resources yourself. Obviously, they've got access to the resources that they've self-selected, but you can also assign set resources to that individual. And if there are resources out there that you don't want a patient to be able to see unless they're assigned by an individual, you can do that as well. And then for that individual patient, you can then view if they've used the resource, have they accessed it? And then you can then obviously see, right, okay, well, this person is accessing this resource and it's helping or not. So you can search for a resource by the category name. And again, we can build out as many categories as you might want. You can search for it using the search function here as well. But if you select the category, it will show you the resources that have been assigned into that category. So yeah, the CBT course on challenging thoughts, between session, there's a between session, etc. There's different resources on here that you can assign. So, you know, if someone's got anxiety, this guy helps you understand the different types of anxiety and more about them, etc. And then they can link out to those different things. So the other thing about this is the reporting function. So we can provide you with reports ourselves, but you can also self-serve with reports. Now we have the ability to build whatever reporting that you might want, but essentially you can choose a report and download it with the date range and via a tenancy. Now, if you want any specific reports, I think we have already built some of those in. So it will then download that report in the right way, showing you know, the management information reporting that you might want. So, you know, are these in the future? It can be like, okay, which groups or regions benefited most from what resources, and then we can really start to hone that down and go, okay, well, actually, let's target those groups, or those groups in a population level have a more severe issue with depression or anxiety or whatever. So we're using this as a sort of reporting and a population level way of assessing different problems, and then seeing if those resources are being used. So there's also ability to contact administrators ourselves. We have a full customer service team that is on standby and can support. And I think crucially, obviously, we have a clinical team, but crucially, I think we're not taking, and you're not taking, any clinical responsibility, which is also why we're not putting in the PHQ-9 or GAD-7 scores directly, because otherwise that could have an inherent mental health risk on this. So this is purely a way of assigning self-help tools for an individual to have them on their own personalized dashboard, and we can provide those localized resources as well. And then we can track the outcomes of, okay, are they accessing the resources? Let's try and promote that so that they do, and let's see if they can get better from it. And this is a way of doing this sort of at a population level rather than needing individual appointments. That I hopefully I made a bit of sense. I'm sorry. Does that make sense? Is there any questions on that to start with?
There's no questions I can see has come through the chat yet, Julian.
Yeah.
So I think for me, the first part of that was great, really. So that's around actually, if you're a WorkWell coach, you have someone referred in front of you who is perhaps struggling at work for anxiety reasons or maybe mood reasons, then that WorkWell coach can use the link and actually either sit with that person or give the link to that person, and they can then self-register on your resource library, fill in a questionnaire, and then be directed to resources that would be helpful for them. That's all fantastic. I think what we then will, so that's the starting point for us, and that's across the whole of the Northeast and North Cumbria. Every WorkWell coach, every PAS advisor can access those resources for the people that are coming through their service. What we then want to work towards is that much more tailored, much more specific area by area, where we can add resources, we can tailor access. I think we would like to get to a point where we've got full access for WorkWell coaches, but that might require some additional data sharing agreements and things to have those in place. So our starting point is very much around freely available access to the resource library. We'll work then with you as WorkWell teams and PAS teams on how we then build the detail of that access and build the detail of what's behind it. We can even make it look like it's from South Shields rather than Cumbria, for example, if that's the direction of travel you want to go in. So that's the end point, and the starting point for us is making sure that because the resources are fantastic, so making sure that they're available to anyone on this pathway, and that you as WorkWell coaches can refer in quite quickly and quite easily, and then we'll build the detail and we'll build the nuance behind that, I think.
Yeah, exactly. I would love to get to a point, because it's white labelable. You can have, it looks like it's your platform where, your logos, etc. This is your ability to have this resource library for your different regions, and then we can personalize them. And I'd love to be able to use it in the future for social prescribing and other things as well. So, yeah, lots of things there. But I think, as Dave says, just to get going, it's a simple. Yes, there is an iPhone and Android app, and also this web app on the phone is also phone accessible, so they can either use it on the browser on their phone, and it's quite simple to use. You can have a play with it. We can show you, but there's also the apps as well that we have. But yes, it's quite accessible on the phone. We've built it in that way essentially. So I just saw a question pop up. So yeah, this is another use case that we're deploying as such. I think just to say, we're also excited because we're deploying in the staff hubs for our therapy services, so people can access that across Cumbria as well.
Yeah. So are there any more questions from anyone coming up? So we will obviously make sure that we get a set of resources out to you as WorkWell teams, which will have all of this information. We'll have the web links. We'll have the codes on and things or we'll have links for anybody who wants to download the app versions for their phones or their smart devices. That'll all be coming to you, and the service is now live. So what I would encourage you to do is to have a look through those resources, start referring your patients through to that resource library, your not patients, whatever phrase it is, citizens, whatever phrase it is that you're using, and actually maybe even sitting with people and registering and going through that first little bit with them might also be super helpful. And if you do get a member of NHS or social care staff coming through, then there is the staff wellbeing hub that Julian's just alluded to, and through that staff wellbeing hub service you can get access to direct therapy from the Dr. Julian team as well, not just the resource library.
And we'd love to work with you. As I say, if there's a resource that that you're like, actually this is good or this isn't good, then we'd love that feedback. And likewise, if you guys have no resources that you normally direct people to, let's say online or a worksheet or whatever, then very simple for us to add those in. So yeah, just let us know.
So are there any further questions? Christine?
Hi, thanks, Dave. Yeah, I just wanted to say, so there'll be an email communication coming out either later today or tomorrow about how people can access it. Also, the link to the information pack, which I believe there's a shared area, DWP shared area, which will upload information there, and also the recording from this webinar. But just to say that this is not the one and only engagement event. We're going to do some more in the new year and have a review meeting so we can invite you along and do a bit of like a focus group to find out how it's going for you, and is it meeting your needs, or have they got any concerns, so can constantly review and tweak things as we go. And then as Julian pointed out, and Dave as well, that we will be meeting with the LDTs and the relevant WorkWell services to customize it, to make it more localized, relevant for your particular area. So I'll be picking that up with the relevant leads in the new year and coming down to meet you all. I
just saw a question come in as well. So can reports with no patient identifiable data, I think that's what PID stands for, be available to gain as understanding of resources that are getting greatest impact? So yes, we can do downloads, as I say, in that reporting function, and we can build reports and we can download them for you and give them to you. You could also self-serve those reports depending on how you want to do it, as data, patient anonymized data. So we can do a global thing and go, right, well, this, and you can even look at the demographics and go, right, well, this population group or whatever is accessing these resources more, and this is the outcomes that they're getting from that. So yes, we can do large bulk uploads with no patient data on them.
Yep. So the next question is from Laura, which was around licenses. So this particular offer, we have 2,000 licenses available across the northeast and North Cumbria is what we've agreed initially. However, there is scope for us to increase that if we reach that maximum amount. So we don't, for this particular solution, want to restrict to say, well, you've got 20 in Cumbria and 20 in North Tyneside. We're just saying, well, actually, there's 2,000. And at the point that we reach that 2,000, we'll review it and we may commission some more. So we don't want you to feel restricted and think, oh, well, I've reached my limit this month, I better not refer anyone. We've initially commissioned 2,000 referrals into the resource library. There is additional funding available if we need it. And we will review that and monitor that along with the Dr. Julian team as we go over the next few months. And to be honest, if we reach 2,000 early in the new year, I'd be a happy bunny, and we'll just increase the capacity. That's not an issue for us. So just refer your people in if you feel it's going to be a helpful resource. And don't worry about thresholds.
Yeah, and we're going to be really flexible on this as well. So it's absolutely fine. Just refer as many as you can if it can benefit them.
Yeah. And then there was a final question, which is a process question, I believe, from. Is it GP practice? Do we send the info web link to patients when they get fit? Now, does the WorkWell coach discuss? So the preferred route is for you to use the WorkWell coach, because the WorkWell coach will be collecting a range of information on that patient, and the WorkWell coach will be able to refer into a number of different interventions, not just this one. So they may choose to refer to 2 or 3 different interventions as well as this one. So for the sake of the program, we'd prefer that to be done via the WorkWell coaches or the PAS workers in all of the areas of the northeast North Cumbria, and we can then monitor that and we can get the best out of that in terms of evaluation. Does that make sense? Have I answered that question well enough?
Yeah, that's answered it. Thank you.
Brilliant. Anything else? Any more questions from anyone else? No, it doesn't seem that we've got any more questions. So, as Christine said, this is not the only. There's another question just popped up. For PAS workers, can we only refer the people who meet the WorkWell criteria? as policies a broader range. So in theory, it's a WorkWell funded solution. So, but I'm aware that we're having conversations with a number of you around broadening the range of referrals in. So not yet, Julie, but we are open to having that conversation with you and the rest of the WorkWell teams around actually how we best use the services. So initially, WorkWell criteria, please, but we're happy to engage in a conversation, over the next month or so to look at broadening that out if it's appropriate.
In case of interest, I've just got on the phone. It's sort of, I don't know, actually, you probably can't see that, but yeah, if we can send you the link. The patient is quite user friendly on the phone, just via the link on the browser as well. So yeah, it's easy to do on the phone.
Okay.
One final question, Dave, from Gavin.
Oh yeah, is it available in other languages?
Oh, sorry. Can you hear me? Yeah. We haven't yet translated it, but if that's something that you guys would want, speak to us about it.
Yeah. So thanks, Gavin. Good question. We will pick that up. With your permission, we'll contact you after today and we'll pick that up as a conversation piece. Okay. I'm pausing now because I guarantee if I say let's end it there, there'll be another question that comes into the chat. Okay, listen, this is the first of a series of get-togethers that we're going to have with the Dr. Julian team. We're really keen in the new year to come and meet you as local teams and work out how we best develop and utilise your tenancy, so your North Tyneside tenancy or your Teesside tenancy, so that you as teams get the best out of it. They're fantastic resources, I have to say. So I would encourage you, anybody who you think would benefit from some self-directed mental health support, then please use the Dr. Julian resource library in the platform.
One thing, sorry, I did forget to show. I'll just quickly show you. When the patient comes in, if you can see my screen, they can click the edit button and they can select the issues that they have help with, of what resources will come up. And likewise, when they first log in, it will show them the screens of the issues that they want to come out with. So that's a way of personalizing it. Sorry, I forgot to show you that bit.
It's all right. So maybe in the new year, what we could do is once we've started getting referrals coming through, is maybe focus a little bit of another webinar or another get together in the new year, which is more focused on that patient journey part of it. Julia, maybe we can pick that up. Okay, I'm going to say thank you very much for joining us for this Lunch and Learn session. And we're really looking forward to working closely with you all over the next few months. Enjoy the rest of your day and thank you for attending.